Hola, mi nombre es Cristal Ocampo Jiménez y trabajo para el Departamento de Salud Pública del Condado de Chatham. Creamos un video para compartir información sobre la vacuna del COVID-19 con los padres de los estudiantes de las escuelas del Condado de Chatham. El video siguiente es ese mismo video con subtítulos en español. Si tiene alguna pregunta sobre la vacuna, llame al 919-545-8323 o visite chathamcountync.gov/coronavirus vacuna. Gracias.
It's not an understatement to say that the COVID-19 pandemic changed the lives of those in Chatham County more than any other event in modern history. Our schools closed to in-person learning, our businesses suffered, and our residents, already at risk for poor health outcomes, were hit hardest by this global health crisis. But Chatham County was resilient. Thousands upon thousands of cloths, face coverings were donated by local businesses, community groups, and individuals. Nonprofits teamed up to provide food and other needed items to families in need. Chatham County Schools teachers and administration adjusted to the need for remote learning. It wasn't easy, it wasn't perfect, but everyone did the best they could to adapt. Now we have a way out of this pandemic: vaccinations. Through May 7th, more than 34,000 Chatham County residents, that's about 46% of the population, have received at least one dose of the COVID-19 vaccine. And more than 29,000 residents, about 40%, are fully vaccinated. While this is an incredible accomplishment on its own, there are still many more individuals to go.
We have all received vaccines to get us to where we are today. From infancy to entering kindergarten to booster shots as adults, all these vaccines have helped protect us from deadly and potentially life-altering diseases over our life. Many vaccines are made by weakening or inactivating the virus in question. The leftover virus is then given to an individual whose cells can respond by creating antibodies. Those antibodies then exist in the body to fight off infection. Because the virus is weakened or inactivated, it cannot replicate or spread within the body.
The Pfizer and Moderna COVID-19 vaccines were made in a really unique and elegant manner. These vaccines were created using messenger RNA or mRNA that act a bit like computer code for our bodies. The messenger RNA tells our bodies to make a protein called a spike protein, and this protein is very similar to what we see on the surface of the COVID virus. Your body's immune system, or its defense system, responds to that tiny little protein by activating its soldiers or creating these antibodies. The antibodies protect us from future illness and protect us from severe illness if we do develop the virus. None of the vaccines can actually give you the virus that causes COVID-19 because they do not contain live virus in them and they do not create the virus.
A safe and effective vaccine not only prevents infection, but likely helps to prevent spread to others as well. That is critical to ending this pandemic that has led to more than 500,000 deaths and millions of infections in the United States alone. As more people get the vaccine, we can return more and more to what we called normal before the pandemic. But to get there, more people need to get vaccinated. Some vaccines, like the flu vaccine, only provide protection for about a year, so you need to get that vaccine each year. Others need additional doses, called boosters, throughout their lifetime. For example, the TD booster shot, which protects against tetanus and diphtheria, is needed every 10 years for adults. Still others are only needed once, or the required number of doses are given early in life. While we're not sure yet whether the COVID-19 vaccine will be given on a yearly basis, like the flu vaccine, the system is in place to produce it, and companies are already working on possible boosters.
As of late April, there are 3 types of COVID-19 vaccines: Pfizer, Moderna, and Johnson & Johnson. The Pfizer vaccine is an mRNA vaccine given in 2 doses, the second 3 weeks after the first. The Moderna vaccine is also an mRNA vaccine given in 2 doses, the second 4 weeks after the first. Both are very effective at preventing COVID-19 disease and have been given to millions of people. The Johnson & Johnson vaccine was made using the adenovirus, though it is modified so you cannot get infected with that virus. It is a 1-dose vaccine that is also very effective in keeping those who get it from getting very sick or dying from COVID-19. All 3 vaccines are very safe and effective. If you have more questions, you can visit www.chathamcountync.gov/coronavirus vaccine to learn more about each.
Right now, all North Carolinians aged 16 and older are eligible to receive the COVID-19 vaccine. Those aged 16 and up can get the Pfizer vaccine, while those aged 18 and older can get the Moderna and the Johnson & Johnson vaccines. Many Chatham teens have already received their vaccine. It is critical that all who are eligible, including 16 and 17-year-olds, get vaccinated so we can beat this pandemic. The more people who are unvaccinated, the more everyone is at risk, including those who are vaccinated. While those who are younger, especially children, are less likely to get sick from and spread COVID-19, we have learned that they can still give the virus to others and get sick. As of this recording, more and more young people are becoming eligible to receive the vaccines as they are being authorized. As more become eligible for the vaccine, it is important that they get vaccinated as well. This will not only protect them, it will also protect their family members, their friends, and their community.
Hi, my name is Maggie, and I'm a 10th grade student at Jordan Matthews, and I am so excited about getting my COVID-19 vaccine because I will be released from the shackles that the virus has put on all of us. There won't be this fear of getting the virus when you go out with people, and I'll just be able to be free to be myself, basically. So yeah, I have never been more excited about getting a shot in my life, and I hope you get one too.
There are several places in Chatham County where your students can get the COVID-19 vaccine when they're eligible, including local pharmacies and other medical facilities. You can find full lists online at 2 places. myspot.nc.gov provides a list of all the locations across North Carolina where vaccines are available, searchable by zip code or city. You can also filter results by type of vaccine. You can also visit www.chathamcountync.gov/coronavirus vaccine for a list of Chatham County locations that have the vaccine and how to schedule your appointment.
We hope that you learned a thing or two about the COVID-19 vaccine in this video. Most importantly, we hope you feel more comfortable with getting vaccinated, both for yourself and your student. We've all been through a lot this past year and are fortunate to have vaccines to move us beyond the pandemic. But to get there, we must roll up our sleeves and get the vaccine. If you have any questions, please visit our webpage, chathamcountync.gov/coronavirus vaccine, or speak to your child's medical provider or school nurse.